Electrotherapy refers using of electrical currents to stimulate nerve and muscle tissues. Electrotherapy is an effective and non-invasive treatment method that can be used for pain relief, muscle strengthening, wound healing, and reducing swelling. However, the success of the treatment depends on the correct selection of current type, frequency, and electrode placement. Improved angiogenesis. Electrical stimulation promotes the formation of new blood vessels, angiogenesis, which is essential for delivering oxygen and nutrients to the healing tissue. Anti-inflammatory effects. Electrical stimulation has anti-inflammatory effects, reducing the release of pro-inflammatory cytokines and promoting a more favorable environment for tissue repair. Electrical currents can be direct, which is called direct current, or alternating, which is called alternating current, and have different effects on body tissues. Direct currents are unidirectional and can cause chemical changes in tissues. Direct current is used in methods such as iontophoresis, which is known as drug delivery through the skin using electrical current. Alternating currents, which change direction periodically, are primarily used for nerve and muscle stimulation. Accelerated collagen synthesis. Electrical currents enhance the synthesis of collagen, the primary structural protein in connective tissues. This leads to stronger and more resilient scar tissue. The third type of the electrical current is pulsed current. This type of current includes short or long pulses and is used for selective stimulation of nerves and muscles. Short pulses are more suitable for sensory and motor nerve stimulation, while long pulses are better for stimulating muscles without nerves. Pulsed electrical currents can accelerate the healing process in both superficial and deep tissues. Enhanced cellular proliferation. Pulsed electrical currents stimulate the proliferation of fibroblasts, keratinocytes, and other cells involved in tissue repair. This leads to faster wound closure and tissue regeneration. Improved angiogenesis. Electrical stimulation promotes the formation of new blood vessels, enhancing oxygen and nutrient delivery to healing tissues. Reduction of edema. Pulsed currents can reduce swelling, edema, by improving lymphatic drainage and reducing fluid accumulation in the tissues. This is particularly beneficial in the early stages of healing. Anti-inflammatory effects. Electrical stimulation reduces pro-inflammatory cytokines, creating a favorable environment for tissue repair. Accelerated collagen synthesis. Electrical currents enhance collagen production, leading to stronger and more resilient scar tissue. Deep tissue penetration. Pulsed currents can penetrate deep into tissues, making them effective for treating deep wounds, muscle injuries, and even bone fractures. Physiological effects of electrical currents. Electrical currents can stimulate nerves by altering the membrane potential, leading to the generation of nerve impulses and subsequent muscle contraction. Electrical currents can directly stimulate muscles, especially in cases where muscle innervation is impaired. This stimulation can help maintain muscle strength and volume. Electrical currents with specific frequencies can stimulate sensory nerves to relieve pain through mechanisms such as the pain gate theory and endorphin release. Additionally, electrotherapy is effective in wound healing, accelerating cell proliferation, and improving fracture recovery. Electrical currents and muscle contractions. The resistance of tissues affects how electrical currents pass through them. Skin has high resistance, while muscles and nerves have low resistance. A motor unit consists of a motor neuron and the muscle fibers it innervates. Electrical stimulation can activate motor units, leading to muscle contractions. Voluntary muscle contractions are controlled by the brain, while electrical stimulation bypasses the brain and directly activates motor neurons. Electrical stimulation is used to strengthen muscles, facilitate muscle control, and maintain joint range of motion. Electrical stimulation can increase muscle strength, but it is less effective than voluntary exercise. Long-term electrical stimulation can change the properties of muscle fibers, such as converting fast-twitch fibers to slow-twitch fibers, increases muscle metabolism and blood flow, which can aid in recovery and reduce muscle fatigue. Electrical stimulation is used to help patients regain control of muscles after injury or surgery. Additionally, electrical stimulation is used to prevent joint stiffness and improve mobility. Functional electrical stimulation technique uses electrical currents to produce functional movements in paralyzed muscles. Electrical stimulation also is used to reduce muscle spasticity by activating antagonist muscles or inhibiting reflex pathways. How electrical stimulation can indirectly reduce pain perception through various mechanisms. The gate control theory of pain. It is worthy to mention that pain receptors, known as nociceptors, are activated by mechanical, thermal, or chemical stimuli. They transmit pain signals to the brain via nerve fibers. Pain signals travel through the spinal cord to the brain, where they are perceived as pain. The gate control theory explains how non-painful stimuli can block pain signals. The theory, proposed by Melzack and Wall, suggests that electrical stimulation can activate large-diameter nerve fibers, known as A-beta fibers, which inhibit the transmission of pain signals carried by smaller diameter fibers, namely C fibers and A-delta fibers. This inhibition occurs at the spinal cord level, effectively closing the gate to pain signals. Release of endorphins. Electrical stimulation, particularly low-frequency stimulation, can trigger the release of endorphins and enkephalins, which are natural pain-relieving substances produced by the body. These substances bind to opioid receptors in the brain and spinal cord, reducing the perception of pain. Descending pain modulation. Electrical stimulation can activate descending pain inhibitory pathways from the brainstem, particularly the periaqueductal gray and rostroventral medulla pathways, which release neurotransmitters like serotonin and norepinephrine. These neurotransmitters inhibit pain signals at the spinal cord level. Reduction of inflammation. Electrical stimulation can reduce inflammation by improving blood flow and reducing the release of pro-inflammatory cytokines. This indirect effect can also contribute to pain relief. Types of electrotherapy currents. Faraday current is used for muscle stimulation, typically applied with short pulses, 0.1 to 1 millimeters, and frequencies of 30 to 100 Hz. Electrical stimulation of nerves through the skin or tens is used for pain relief, typically applied with high frequency and low intensity. Interferential current is generated by the interference of two medium frequency currents within the tissue. This method is used for deep tissue stimulation, pain relief, reducing swelling, and muscle stimulation. Diadynamic current is used for pain relief, reducing inflammation, and increasing local blood circulation. Russian current is applied with medium frequency, 2500 Hz, and short pulses, used for muscle stimulation and increasing muscle strength. Low-frequency stimulations. Low-frequency electrical pulses, typically below 1 kHz, are used to stimulate nerves and muscles. These pulses can depolarize nerve fibers, leading to muscle contractions or pain relief depending on the application. Interrupted current. Interrupted current involves turning the current on and off at regular intervals. This type of current is used to create specific pulse patterns for therapeutic purposes. Long-duration pulses. Pulses lasting more than 1 millisecond are used to stimulate sensory and motor nerves. Short-duration pulses. Pulses lasting less than 1 millisecond are used for selective stimulation of motor nerves or pain relief. High-voltage pulsed galvanic stimulation is characterized by very short pulses, less than 1 millimeters, and high voltage 100 to 500 V. High-voltage pulsed galvanic stimulation is effective for deep tissue stimulation, pain relief, reducing swelling, and improving muscle function. It can also accelerate wound healing by increasing blood circulation and tissue repair. It can increase DNA and protein synthesis in fibroblasts. Fibroblasts are the main cells in the production of collagen and the repair of damaged tissues. Safety considerations. In sensitive areas such as the chest or near cardiac pacemakers, electrical currents should be used with caution. For patients with sensitive or damaged skin, electrical current should be applied carefully to avoid burns or skin damage. Accurate adjustment of current intensity and treatment duration is essential for each patient. In the iontophoresis method, the appropriate drug concentration and current intensity must be used to prevent side effects such as skin irritation. Iontophoresis is an electrotherapy technique that uses direct electrical current to deliver ionized drugs into body tissues. This method is used for treating local inflammation, pain relief, and excessive sweating, hyperhidrosis. Drugs such as dexamethasone, which is an anti-inflammatory, and lidocaine, which is an anesthetic, are delivered through iontophoresis. The advantage of iontophoresis is that drugs are delivered locally without the need for injection, reducing the risks associated with injections. Local anesthesia. Iontophoresis is used to deliver anesthetic drugs like lidocaine into tissues for local anesthesia in small areas such as the skin or joints. Treatment of idiopathic hyperhidrosis. Iontophoresis is used with antiperspirant drugs like glycopyrronium bromide to treat excessive sweating in areas such as the palms and feet. Antibiotic delivery. Iontophoresis is used to deliver antibiotics like gentamicin into infected tissues, particularly effective for treating skin and cartilage infections. Anti-inflammatory drug delivery. Iontophoresis is used to deliver anti-inflammatory drugs like diclofenac and salicylates into inflamed tissues, useful for treating tendon and joint inflammation. Use of vinca alkaloids. Vinca alkaloids like vincristine and vinblastine are delivered through iontophoresis to treat neurogenic muscle pain. These drugs reduce pain by inhibiting pain signal transmission in nerves.